Hello everyone. Today we already arrived at the FC Center of Visionary Hospital. According to the posting in our Facebook, we have so many inquiry about IVF procedure. So right now I'm here with Dr. Watt. She respond to ask many people questions, and Dr. will explain about every detail. Yes, good evening, Kat.
Good evening.
So right now, IVF process is quite popular. It's as for the latest technology among the couple. So right now, after I'm posting in the Facebook, so many people, they are quite curious about this kind of the procedure. One person wants to know about what is the difference between IVF and ICSI.
For overall process of ICSI and IVF is the same. It's including egg stimulation, ovum pickup, and then raise the embryo until the blastocyst embryo before transfer back to the womb. But the different stage is during the fertilization. For IVF, we mix sperm and egg together and let sperm fertilize itself. Compared to the ICSI, ICSI stands for Intracytoplasmic Sperm Injection. So we choose the best sperm and inject one sperm into the ovary to make it fertilization. For ICSI, it can increase the success of fertilization.
So for the couple like who want to start the IVF process, but what kind of the preparation that do they have to do?
Before start treatment, even in IVF or ICSI, I suggest them to keep a protein diet, a high protein diet, and also get an exercise and take a rest, and also take the vitamin supplement at least 1 to 2 months before start egg stimulation.
What is the ovarian stimulation, and also that kind of the medicines can affect to the health of the mother?
The egg stimulation process is used to increase the amount of egg. So if we have a lot amount of egg, it can increase the chance of pregnancy. In natural month, if we do nothing, the egg will grow only one. But to get only one egg per month, the success of IVF or ICSI is low. So we use a hormone injection. We use this daily injection to stimulate the growth of the egg in the same time. So if we get more egg, we get more chance of pregnancy. Because this is a hormone medicine, so patient may get the side effect of hormone, including difficult to sleep, bloating, difficult to eat some food, but it's just a short period. After we stop the egg stimulation, the symptom will disappear.
If they're doing the egg stimulation, how many times do they have to come to hospital, or they need to admission, or like just both of the couple have to come here during this period?
For egg stimulation, the total period is around 2 weeks. Start from when period come. We use a hormonal injection every day. Actually, patient can inject medicine themselves, but if they cannot inject, they should visit the hospital for injection every day. If they can inject themselves, we just make an appointment for every 3 to 5 days to check the response. So patient may come to visit the hospital in total of 2 weeks is around 3 to 4 times.
So after the ovulation period is finished, you also have to perform the egg collection, right?
Yes, after we use the egg stimulation, when the size of egg is reached the optimal size, we do an ovum pickup.
For the pregnant mother, what kind of age or the weight is the best for the IVF process to be successful?
It's sure that when we get older, the chance to get pregnant is lower, and also is higher risk of complication during pregnancy. There are no definite limitation of the age to get pregnant. But when we get older than 40 years old, also difficult to get pregnancy and higher complication, including diabetes during pregnancy and also hypertension during pregnancy. But if we get pregnant and under control of the doctor, I think overall can get pregnant and also get a healthy baby.
IVF process is sometimes related with the menstruation. So for the lady with the irregular menstruations, or if the lady have a problem, so what kind of thing do they have to prepare for this?
There are many diseases that may affect to the menstruation period of the woman. So it's better to check the blood and other diseases that may affect to the menstruation period. So I suggest to start with a blood test to confirm that everything is okay. And if no disease, we can start an egg stimulation by using a medicine to induce her period before start stimulation.
Is there any effect on the egg quality related with this menstruation?
The most factor that affect to the quality of egg is when we get older. The age is more important. Even some women who have abnormal period affect from the quality of egg. But if they have a lot of egg, they also have a better chance to get pregnant.
The couple, they also have to control the diet or any supplement. Is it better to get good quality egg?
For sure, when we get healthy lifestyle, get a better diet and also a vitamin supplement, it can improve the quality of egg at least 5%. So in final, the quality of embryo will be better.
So for the mother, they take at least 10 days. So how about for the father?
Because more treatment focus on the woman. So for the 2 weeks, better for husband. Only one day that we need his sperm is on the date of ovum pickup. When we get the egg on that ovum pickup date, we also need a sperm to prepare it for fertilization in the same day.
So after the fertilization process is finished, how will you transfer the embryos to the mother?
For now, after we have an egg and fertilize with sperm and then raise until the embryo. In case that we freeze the embryo, we will wait for the later month when her period come again to start the preparation process for embryo transfer. It's not in the same month, but we separate between egg stimulation and embryo transfer in another month.
Doctor already transfer the embryo. So at the time for the mother, do they have to aware of anything like do's and don'ts to give the successful rate?
Because embryo is very small for embryo transfer process, it's just like a pelvic exam, insert a small tube into the womb and inject the embryo into the womb under transabdominal ultrasound guide. After they go back home, actually they can do daily lifestyle in the house, in the room, but not lifting heavy things, or also avoid of sex or vaginal douche. But other thing is normal. They can get a diet as a normal. They can take a bath and take a rest as normal.
So some of the couples, they are not successful in this procedure. So if they are failed this time, so can they try another time?
If the first cycle of egg stimulation, the response is not good, or even until the final, they can have a normal chromosome embryo to transfer back to the womb, we can start from the first step again. But we will change the treatment to make it better in the later cycle.
Some of the mother already delivered many baby before. So some they do like a normal delivery, some they have a cesarean section, and sometimes some mother have abnormal like abortions. This IVF process is safe for them, or is it a good choice for them?
In the women who have many times of miscarriages, there may be some underlying disease that affect to the pregnancy. So we will test to check other disease that may affect to the pregnancy. It's better to confirm that everything is okay before start pregnancy again. And also for the women who get a cesarean section before, actually we suggest only 1 or 2 times of cesarean section, because the third time or fourth time of cesarean section increase the risk during operation.
They also doing the contraception method. It's the sterilization, or sometimes they also taking the pill. But normally they already make the tubation or tube reception, or for the man is that they already make a vasectomy, so they can do the IVF process. Or if they can do they have any intervals for the decorations of this procedure and studying the IVF process?
For the pill and other medicine, it just stop that treatment before start egg stimulation, before start IVF. But even in women who get tumor resection or the man who get sterilization, we can do an ICSI without any surgery, because in the process of egg stimulation, we use a hormonal injection, and when the egg reach the optimal size, we use a needle to aspirate the egg directly from the ovary. So it's no need to use a tube. And then when we have egg, we fertilize with sperm, rest until the blastocyst embryo, and then transfer back to the womb. In the process of transfer embryo back to the womb, it's transferred through the vagina, through the cervix, inside the womb cavity. So it's also no need to use tube. So even in patient, a woman who get a tubal resection already, we also can do an ICSI without any surgical correction. And even for the man who get a sterilization, we use only a needle to aspirate the sperm directly from the testes and use for fertilization by ICSI with the egg.
If they are doing the sterilization for many years, like 10 years or too long, so at the time it can affect on the quality of sperm or quality of egg.
It's not only the time from the sterilization or tubal resection, but when we get older, the quality will bad compared to when we're younger. If they have a history of sterilization for a long time, in this case, if women have a long time of tubal resection and now she get older, I suggest to start with basic investigation to check the number of egg or the hormone, to check that her ovary is still okay to get more pregnancy.
Some parents, they have a genetically disease. Do they have to do the genetic test before starting the IVF or after the sterilization process is finished?
For the genetic test, we have two parts of genetic test. The first one is a PGTA, pre-implantation genetic testing for aneuploidy. It's just to check that the embryo have a normal chromosome. It means only just 46XX for the girl and 46XY for the boy. But part of genetic test is PGTM or PGTSR. It's just used for the couple who have a genetic disease. If the couple or family have a genetic disease that pass from generation to generation, we can do this genetic test of embryo to choose the healthy embryo before transfer to the womb.
During IVF process or ICSI process, is there any side effect of the risk to the mother or father?
Short-term side effect of IVF or ICSI is very low. For example, just as for the hormonal side effect, difficult to sleep, bloating. For the operation, we use a needle to aspirate the egg from the ovary. The risk of this surgery is very low, less than 1% of complication. And also, when we have the embryo from the IVF or ICSI process is almost at the same baby from the natural pregnancy. So in overall process of IVF and ICSI is just like a low risk operation.
Because sometimes they are the single mom or single father, so they can get the donation from their siblings to get the baby by IVF.
Because it starts with a marriage certificate, so we cannot start the treatment.
We already covered so many information about the IVF or ICS. Thank you so much for the time to answer these questions. And also, if you want to know more about IVF or ICS, you can contact our page and consult with our doctor at Vitro Hospital. Thank you.